All Business Media presents the Professionals Roundtable. Hear what's hot in the professional world. Timely topics to propel your career to the next level. Professionals Roundtable with Robert Wetham, exclusively on All Business Media.
Welcome back to the show. My next guest is from Oklahoma. She is the owner of Wyatt Group Counseling. Ladies and gentlemen, Dr. Vicki Wyatt. Welcome to the show.
Thank you, sir. Thanks for having me. I appreciate the opportunity.
You got it. No problem. How are you today?
I'm doing very well, thank you.
Okay, excellent. So, Dr. Wyatt, can you start off by giving us a quick description of what it is that you do?
I am a private practice therapist in downtown Oklahoma City. I see individuals and couples, specifically around marital issues or sex addiction issues, relationships. So I have a pretty broad practice, but the last few years I've specialized more in working with couples around infidelity and pornography addictions and how those have affected their relationships and intimacy issues.
How prevalent is that in society, do you think?
It's very prevalent. I don't quite have the statistics, but I have been featured on this type has been as part of my practice for the past since 2002. And during that time, I've seen it grow and increase the need. I do groups. I've seen more and more need for groups and doing as well as individuals. So the number has increased, and not only for the older couples. What I say, couples have been married 20, 30 years, but also couples who are in their 20s, and also single people that are now reaching out for help with these areas, and teenagers parents that are also bringing their teenagers in. So you see a change in the dynamic just in the past 10 years. Since I've been focusing on this in my practice.
All right, very good. So what do you think are some of the major causes of infidelity?
Sometimes it's just, if you look at just infidelity, there's possible communication issues, trust issues. Lots of times it's things from unresolved issues from their family of origin, from their childhood, or from past relationships, that people leave things unattended until they explode, and then they seek other ways of dealing with it versus trusting that they can go to their partner to discuss it. So they find another way to escape and to try to medicate their feelings sometimes versus really addressing it with the person in their relationship.
Now, you also deal with ADD and ADHD issues as well, correct?
That's correct. I use neurofeedback and some biofeedback techniques like heart rate variability in doing neurofeedback training for ADD and ADHD. I've been doing that also since 2002 as part of my practice. And so people, whether they have addiction issues and focus and attention issues, also contribute sometimes to problems in marriages and relationships. So I work also with children, teenagers, and adults, and address those issues as well. I do some pre-testing with them called the TOVA, Testing of Variables of Attention, that help give us some information as to that problem. It's not a diagnostic tool, but it just gives us some basic information as to what we need to do to address those issues.
Something I think is pretty interesting is you do brain training for peak performance. Can you explain?
The brain training that I do uses the neurofeedback and the heart rate variability. Basically, it's about focus and attention. And so when someone comes in, I'm looking at holistically at everything about them, and so you want to see, what you need to do to maybe help their brain function more effectively and efficiently. And I found the neurofeedback and biofeedback has worked wonderfully for those issues in the past several years. So whether you're a professional dealing with panic attacks or anxiety about performance, or you're a teenager that's dealing with those, we try to address when are those occurring and how to help you manage those feelings and emotions so in the moment you can perform up to your level of ability.
A lot of people out there suffer from anger management issues, whether it's due to, compulsive behaviors or depression. So how do you treat that?
With the anger, I'll do the same kind of brain training and relaxation, and the heart rate variability works very well with that. But I also do an educational program. I may, depending on the individual, what educational workbook that I may use with them. So they have homework, and so we're looking at the triggers or their patterns of behavior, what sets it off. how then to do some of the breath work to kind of manage some of those emotions before they escalate to the point of outburst. A lot of that, again, depends on the brain and understanding the brain and the chemistry that goes along with that person, and so trying to help regulate and teach them to self-regulate, whether you're having a temper tantrum as an 8-year-old or a 40 or 50-year-old, helping them manage that and work to manage that more effectively. As
you're fully aware, there is a big-time addiction problem in this country, whether it's to opioids or some other drugs, alcohol, gambling. How do you manage addiction? Again,
usually when someone comes in, I do like a thorough intake interview with them. And I'm looking at all areas of, like, I look at the genetic component, I look at family history, as well as, what are some of the situations that where they first started this behavior and how it escalated through the years. So we're looking, how to help establish a safe and secure environment for them to be able to manage those behaviors. And to establish a level of sobriety so that they've got some sobriety in that area, and what are the support systems they need, who are the support systems that are already in their life, and then how do we build on the support systems that are there, and if there are not any that's there, how do we help them develop those in those areas of their lives? So we look for community resources, we look for resources in their family, and and professional resources to help guide them in that area. Sometimes that requires treatment, inpatient treatment. Sometimes they already have a structure and they need that's in place for them, and we just need to help, strengthen that and through the individual counseling.
All right, the last thing I want to talk about is EDMR therapy. Can you tell us what that is?
Yes, it's eye movement desensitization and reprocessing. EMDR, it's a way of dealing with trauma, and one of the things that I do also is working as a trauma specialist, working with people around trauma. And EMDR has been established as a technique, a modality and a technique that helps deal with trauma, whether it's PTSD, that's related to coming back from combat, or whether it's PTSD from family abuse. But it's a process whereas you help reprocess your feelings and memories around a specific event in your life, so that event, of course you don't erase those memories, but you help to reprogram those memories or reprocess those feelings around that event so that it doesn't trigger you and cause you to shut down like it has been in the past, like it possibly has in the past. It was developed by Francis Shapiro.
Okay. All right, very good. Listen, it sounds like you have a lot of different ways that you can help people. What is the best way for my audience to contact you if anybody has more questions?
They can contact me on my work number is 405-232-1000, or they can email me at Vicki Wyatt at wyattgroup.biz. That's VICKIWYATT at WYATTGROUP.B as in boy, IZ. Be glad to answer any other questions or address any other concerns that someone might have.
All right, perfect. Very well done. Dr. Vicki Wyatt, thank you for your time today. I appreciate it.
Dr. Vicki Wyatt, thank you so much for having me, Robert.
This is the Professionals Roundtable, All Business Media FM. We'll be back after this short break. Please don't go anywhere.
All Business Media presents the